Hi, thank you for coming. This is a recording of one of our Friday morning training sessions currently. And we'll be doing first a series of exercises for strengthening and rehabilitating plantar fascia. And also we'll go through a very thorough spine care series. And it will give you more ability for everything you do, whether you're very athletic or if you just want to maintain an active lifestyle. This training session particularly will be of great benefit. And we're going to start out with just a few areas of soft tissue work. So you have a massage ball, or you can use something like a tennis ball. I'm just going to move the camera. We're starting out rolling out the pectoral muscles in the chest. And the best way to do this is in a corner of a room or in a door frame. So here we have this corner of the wall, and it gives you a better angle into the chest. So you see when you're in this corner, you can put the ball here. So we're going to work along the collarbone, just along the bottom edge. You can go around the breast a bit like that. The arm should be down, and your head should be turned away from the ball and angled down. And mostly, you'll go side to side across, but you want to be sure to reach right in towards the sternum, your chest bone, along the collarbone, between the collarbone and the first rib. Okay, and then out on the inside of the shoulder. And then we'll bring the arm up a little higher if you can do that. And deliver across the tendons of the pecs here at the edge of the chest. Okay, so now we'll work on the other side. So first just below the collarbone, around the breast, and the head angled down. So your neck should be very relaxed here. This is my last few days visiting Costa Rica. I've been here for 2 months. And so the time difference is 2 hours. So for me, it's currently 2 hours earlier than the East Coast. Or I mean the Eastern time zone. Now bring the arm up like this. So you can get right, you see right around the edge of your shoulder, around the edge of the humerus. And now the roosters, it's around 6 o'clock, so the roosters are waking us all up. And the morning doves are joining in, it's beautiful. Okay. So next thing we'll work on the upper back. Some people would like to do this on the floor. On the floor, you get more pressure, but we're going to easier to demonstrate in the standing position. So here in the wall. So you're just right here, just at the base of the neck. So I like to go around the base of the neck, with upper trapezius, levator scapula muscles. The attachments up into the cervical spine. And then I'm here starting on the left side, and then horizontally across the upper traps and the supraspinatus. And if it's a bit sore, you can just press onto it or move up and down or horizontally. And then next around the shoulder, so we'll just go around the back of the shoulder, and we're going to work our way down around the shoulder blade and in between the spine and the shoulder blade. So you just set more outside, and you'll feel the edge of your shoulder blade. And if you're lying on the floor, it's easier to just put pressure there. If you're standing, you can easily move side to side between the spine and shoulder blade. So now we're doing little trapezius muscle. The rhomboids are here, the serratus posterior muscle. Okay, and work your way a little further down. So now just around the lower trapezius, at the bottom edge of the shoulder blade. Okay, and for the shoulder external rotators, we'll next put the ball right here. It's the crease at the edge of the arm, where the arm attaches to your torso. Many people know the infraspinatus and teres minor muscles. Okay, that was great. So now the other side, along here, just along the base of the neck, right side. Okay, and horizontally across the upper traps. Okay, and then down a little more to the outside around the shoulder blade. Okay, and horizontally between the shoulder blade and the spine. So I'm mentioning the roosters because you might hear them, and that's why they're very happily waking us up every morning, and I love it. Gets you right up at sunrise. Make the best of the day. Okay, a little lower now in the lower trapezius. So it's still, between the shoulder blade and spine. And now the infraspinatus here at the edge of your underarm. So this can be quite sharp. If your shoulders are quite internally rotated, then it gets pinched here. And when you find the spot, your arm might go a little bit numb. So now we're going to work on the glutes, on the buttock muscles. Okay, so here, I like to start. So here's femur, your leg bone, and attaches up into the hip. We're going to work around the edge of the femur, the top of the femur, or the trochanter. So you're on the side, but you should feel the edge of the leg bone. So it's right where your leg inserts into the socket of your hip. And the hip external rotator. So there's another kind of spot here that's usually very sensitive. It's about a 45-degree angle right here. So when you externally rotate or move the leg to the side, abduct the leg, it often gets pinched in there if the femur isn't moving freely. Okay, and now we'll turn toward the back. So here more toward the coccyx or the tailbone. And there's a lower curve of the pelvis. Okay, and then up here, so the sacrum, this bony structure sits like that in your pelvis, and the edge of it is right here, right like this. So we're going to work our way up along the edge of the sacrum, and you can move side to side or just put pressure. And on the floor, especially if you do this on the floor, your body weight will sink and you might get numbness or tingling down the leg if the piriformis is squeezing the sciatic nerve. The piriformis muscle here attaches. Okay, now there's this corner of right here, where the sacrum meets the horizontal ridge of your pelvis, the iliac crest. So we'll just press into that corner for a second. Okay, and then move horizontally across along the edge of the iliac crest. And here you'll find there are bands, the tendons of the glutes, where it'll feel a bit sore. And then to the outside again. So now here a little higher. Earlier we were down here around the femur, now we're at that upper edge of your pelvis. Right on the side. Again, this area is kind of a corner of your pelvis. The muscles get jammed up in there, and it can be very sensitive, and your leg might go a little numb. That just means, the nerves are being pinched, the muscles are tight, so it'll relieve the tension when you do this series. Okay, now we'll work on the other side, so now just around the top of the femur. Okay, and then work your way around the head of the femur. Often the right side for many people is quite tight, and driving I think is a factor from that leg just being active a lot. If you've gone for a long drive, you'll know your right hip will get really sore. Okay, then a little lower down, so this corner here at about a 45-degree angle. And down by the coccyx. And then up vertically along the sacrum, and then you can go a bit like that side to side, across the glutes, or just put pressure up and down along the sacrum. Okay, a little higher, so this corner where the sacrum meets the iliac crest. And then work your way out toward outside. And now we're directly on the side, but this time again the ball's a little higher up into the hip. Okay, and then we're going to move on to the floor, and I always like to pay attention to the neck. So here we'll work on the neck, and then we'll start our plantar fascia series after that. Many of us in our culture, cell phones, like just look at people on a cell phone, right? The heads are hanging forward, and then we carry that posture into our everyday activities. And ends up preventing us from doing the things we like, from neck discomfort, degenerated discs, and other things. So the ball will be just here at the base of the skull, and it's best if you put the ball on top of a book. And you'll have to hold the ball in place. And we're just going to do this kind of quickly, but you put the ball at the base of the skull in different spots and just press down a little, but right along the base of the skull. And then if you want to, you can, roll out the muscles of your neck a little. It's kind of awkward, but especially along the base of the skull to release the suboccipital muscles. Okay, and switch to the other side. Okay. So from here, if you prefer, you can sit in a chair. Oh no, let's do the quads first. So for the quadricep muscles, we'll use a foam roller or rolling pin. You can sit in a chair like this and just roll out your quads. We need to tone them down before we start working on the spine. On the floor, we'll use this plank position, and I like to do just one leg at a time. If you put both legs on a foam roller, when you're working on the quads, you tend to hyperextend the lower back. So we're going to just start at the knee and then only right leg, and gradually work up toward the front of the hip. Make sure you have really good core support, and you should be looking down into the floor. Definitely don't look forward. That will hyperextend your neck and lower back. And then when you get to the top of the leg, on the outside is the TFL. So right here, TFL. And then the front of the hip on the hip flexors. And the TFL attaches to your iliotibial band. Okay, and so next the left leg, starting just above the knee. your strong plank position. And gradually working up. And I like to rotate the leg in different angles, so not just the middle, but slightly rotate your leg in and a bit out. But you're still on the quads. Okay, and then at the top of the leg, on the outside of the hip, in your plantar fascia lata, and then the front of the hip and the hip flexors. And the psoas muscle, really important that we help to release that one. Okay, so that's enough soft tissue for today, for now, and we're going to start working on plantar fascia. So, if you prefer, you can do these first few things for circulation into the feet, sitting in a chair. Or on the floor, goes like this. So you have the toes, and you just want to scrunch and spread the toes. You can see, so these goes scrunch and spread, scrunch and spread. If you're sitting on the floor, it's best that you have the hands behind your hips a little, fingers angled out and chest up. Try not to sink down into your rotator cuff. And at the same time, don't arch your back. Keep the chin in. Okay, so toes scrunch and spread. Now we're doing this a little quickly at this moment, just basically for circulation. And try to incorporate all of the toes, including the baby toe, and see if you can spread it and scrunch and spread and scrunch. There is an arch in the forefoot. So here in this part of your foot, there's an arch right here called the transverse arch. So when you scrunch, you would like to try to feel like that. Can you see when you do like this? So there's an arch in there. A lot of us, that arch drops and people get pain on the top of their foot and sometimes fractures in the metatarsals just because that arch drops. Okay, so next I'm going to do ankle flexion and extension. So you just like this now we're moving the ankles, okay? If you're on a chair, keep the heels on the floor as you do this and integrate the feet, the toes in me. So do spread and scrunch the toes as you are bending and straightening your ankles. And if you're sitting on the floor, just keep those arms strong, chest up, and chin in. Everybody chin in. And here, as we go through this series, the toes, so the ankle, right? You don't want to be out toeing. So your feet shouldn't be angled out. You want the feet centered. Okay, so next we're going to work on the toes individually. So you take your foot and then you take the big toe, the next toe, and bend them in opposite directions. We're going to work all the individual toes. Try not to twist the ankle, so your ankle should be still kind of straight like that. Don't like twist your foot out. And I know depending on hip mobility and other factors, you might not be able to reach your toes very well in a chair. You might be able to do something like this. But we do want to be able to actually move our toes around with our hands. The next two toes, that we have the most proprioceptors in our feet and our hands. So when we can connect those two, we'll wake up our nerves. The next two toes, if this is a bit uncomfortable, often it's because the skin is just too tight. And as you do it regularly, the skin, next two toes, the skin will become more elastic and it will be more comfortable, and you'll be able to move the toes a lot and without discomfort. Okay, switch feet. So big toe and next toe. And the next two toes. So this is right where the anterior arch is. So you need to be able to move those two toes independently. And sometimes people get overlapping toes, right? So this will help spread them. next two toes. The toe knuckles, like try to straighten them. As you're doing this, keep the toes straight. Like I hold on to the toe knuckles so that they don't bend. Next two toes to try to help prevent from hammer toes building up. So all of these things are going to help your plantar fascia. Okay, from here we're going to stand up. And we're just standing, and I'm going to move the camera so that you can just see the feet more clearly. This first one, you might have to sit in a chair. Okay, so we go big toes down, other toes lift, other toes down, big toes lift. And you can do 1 foot at a time. And if you can't do that, you hold the big toes, lift the other toes, hold the other toes, lift the big toes. And you can do that, like I said, sit in a chair and just hold the toes down and try to help. Now, you'll notice you get a bit of ankle rotation with this. So this is really building up the plasticity of your plantar fascia. Plantar fascia is this under the arch, like between your forefoot and heel, all the muscles under, or the tissues under there. And when our feet get weak, it like tissue paper, it starts falling apart and then gets irritated and inflamed. Okay, so then next we're going to take the feet a little wider, not too wide though, just a bit wider than hip width. We're rocking through the ankles. So you're not twisting your hips, you're not twisting your back, you're not twisting the knees. It's just a slight rotation through the ankle joints. So there's a bit of a rotation, but this. Okay, and now we're going to go through a massage ball. So you can use a massage ball. There's another thing called a soulmate that works really well. But something that you can step on to put pressure on the plantar fascia. One thing that works really well is like a broomstick. So if you have a broomstick, we'll just like this walk, take small steps across the broomstick. When you first try this, it can be quite excruciating. If you do these kind of things regularly, like this doesn't hurt at all, actually. I can't hardly feel it. And the first time I tried, it was, like I said, excruciating. And now the ball, so ball is good, but if you can get something more firm or different that doesn't move around, so I have this rock, it's some kind of a pumice stone. So you just can stand on it and you see you can put pressure in different parts of your arch. The ball, you can roll it around and you can put a little pressure, but something like this rock, you can really press down to remold your plantar fascia. And okay, now we'll switch feet and just put pressure into your arch a bit. Different angles, all different angles, right? Okay, so there are 3 arches in our feet. There's this one in the middle, we all know that. And then this one here that I mentioned, that's anterior arch. There's also an arch there. That's the lateral arch, you see like this. And this lateral arch is where we have the most proprioceptors in our feet. Okay, that's where you get the most nerve endings. And when we sit and our feet pronate, right, our feet go like that, then we lose pressure on the lateral arch. And because of that, the nerve endings die off because we're not using them. And that's where you get the most sensitivity for balance. So if your lateral arch nerves are shut off, you're not going to have good balance. So you see that's, I'm here and pressing down on the outside arch, in between the heel and the baby toe, like that. And also on the front arch, right? So I'm kind of wrapping the forefoot around this rock to get into that anterior arch. So I'll do the same on the other foot here on the lateral arch. And then on the anterior arch. And obviously we've already done this medial arch. Okay, So there now that was our remolding soft tissue. Next we're going to you need a rolled up towel. There's something called a toe pro that we use regularly. You can use that or the soulmate again. So I'm just standing up, okay? I'm going to show you the feet, but I'm just really standing vertically. So first we're going to work on just stretching the toe box, the toes themselves. The toes should be somewhat straight. You don't want the toes to be like curling up here, okay? So you have only the forefoot. See that? Only the toes are on it. And then you step forward and back a few times. So when you do this, try not to curve around your leg, like curving around like this. See, this back foot that's moving should go directly forward and back. You can see that? Directly forward and back. Don't let your body twist in the hip joint. Okay, now we're going to stretch. You step forward and bend the toes and lift the heel with the leg straight. Back and bend into the big toe. And also make sure all the toes, ideally all your toes are up. Depends on your feet. But like I said, the toe knuckles here should be straight, not clawing. Okay, now we'll switch feet. Okay, so all the toes are up. And forward and back, even the baby toe. And then bend the toes, keeping the legs straight. And definitely press into the ball of the foot if you can do that, if it's not too painful. And then make sure also the baby toe, you're bending. Okay, so next for the calves, you step over with the foot on it this time, only the heel down. And then you step forward and back. And now we're going to step around. So now this time the front foot, you step around the front of the other foot. Keep the back leg straight and the big toe down. Don't let the big toe roll up. So you're stretching around the ankle and okay, you should feel this around your ankle joint depending on you, but ideally inside of shin. Switch sides, so we'll have the other foot up. So the foot is up, heel down, and step forward and back. And then step around and hold, keeping the knees straight. And you know, if you've sprained ankles or you walk with a gait where the feet are imbalanced, then you might know it's quite different on both feet. But with regular practice, you'll even out your feet, your gait, and your entire body. Okay, and now rest. Okay, now lastly, I like to do a couple of things just to integrate that whole system, the body, along with what we just did with our feet. If you would like to, it's good to use a rolled up sock or a hacky sack. I'm just going to slide my foot along the floor. The first action is you slide the foot forward and back. So we're standing on the left foot, right foot, the toes are on the floor, forward and back. Just see, you'd like to keep the toes always on the floor. Okay, and now we'll switch. So left foot, right foot is supporting and left foot is sliding. Toes forward, keep the toes on the floor. Only the toes. Or toes and forefoot. But not the heel. Okay, and now something like a speed skater side to side. So we're going to do cross behind, keep the foot close to the heel, and then out to the side. Here the foot is directly in line with the other foot. You don't bring the foot back like that. Your pelvis is always square. So we'll go left foot supporting, right foot cross behind, then out to the right, cross behind, and again, it's the toes are in contact. That's why the hacky sack or the sock really help out. Okay, and then switch. Right foot supporting, toes are forward, left foot, cross behind, out to the left. The body weight is always on the leg that's not moving. Don't shift body weight to the moving leg. Body weight always on the non-moving leg. And rest. And now lastly, you just spread your toes, press them onto the floor, and do a bit of a hip hinge. And lift the heels. Keep the toes spread. And hold. So now we're lengthening and strengthening the toes, and your plantar fascia is getting stronger, longer and stronger. So this kind of series every day will really help with any kind of foot problems. And rest. All right, and so now we're starting our back series. So first we'll just walk around. So let's practice. You go heel, outside the foot, baby toe to big toe. And then next one, heel, outside the foot, baby toe to big toe. And since we've done all that work, let's really pay attention to how our toes are moving. So as you're stepping through, heel, outside foot, so each individual toe. And then step, baby toe, and then each individual toe. And keep going. And that will help integrate all the work that we've done so that when you're moving around, walking, running, and other things, your body, your feet will move more proficiently. So to start out, commonly right before we start the back strengthening work, we'll just go like this. And arching and rounding the back a bit, this kind of cat-cow action. But very gently, it's not meant to be a big stretch here. This is meant to just prepare the spine to gently floss the spine. I'm going to put these toe spacers, now that we just mobilized our feet, then these will force the toes to stay apart. So the toes and foot will work harder and it will strengthen your plantar fascia. So if you can continue with cat-cow, if you have toe spacers, I would put them in. And I'm going to describe, as we go through this next series, it's a little complex because there are different options. Option one, for the first group, the most challenging is you would lie down on the bed. The second option is you lie down on an ottoman, or if you have a big stability ball, either of those will work. The third option is you just do the bird dog, so you don't need any equipment. All right, so if you could please get whatever you normally would use. You have ottoman or stability ball. For this first position, you can use a bed. So imagine this is a bed. You would lie down on your bed with the chin supported, the hands at the lower back, and you just slide the hands across. You lift the arms off the back and slide the arms across. And so that's the bed version. Your chin is supported. The ottoman version is your abdomen and hips are supported. Okay, your hands are at the lower back, chin in, and legs are straight, and you just lift the torso only a little. Your lower back shouldn't be cramping. It should be bracing, but not cramping, and then you just relax. And then again, we'll lift and do a hold. The bird dog people, we're lifting only one limb at a time. So bird dog group, you'll lift only arm or leg. So when you do the arm, it will look like this. I'll just tell you which arm and how long you just hold. I externally rotate when I do that. If you do the legs, you just always keep the hips level. And when we do the legs, you just like this, lift one leg and hold. Okay, so that's the bird dog version. So whichever you like, we're going through a series of 4 different angles, 4 different positions for spine strengthening. So this is number 1, the torso lift version. So bird dog people, you're lifting right arm only. We'll do this together. The bed group, your chin is supported. The Ottoman group, your abdomen is supported. Okay, so Ottoman people is torso lift. Bed group people is both arms lift and cross the arms over each other. Bird dog people, right arm. We're doing 15-second holds. Everyone rest. Okay, so Ottoman and bed people, same. Bird dog group is left arm. Okay, and now rest. In position 2 is leg lift. So here the options are Ottoman or stability ball or bird dog. Bird dog is lift only left leg. The ball group or Ottoman group is heels together, both legs lift and hold. And rest. Everyone brace your lower back. Bird dog right leg, other group both legs. Keep the lower back and lower abdomen brace all the time. Chin in, eyes looking straight down to the floor. And rest. Okay, so next for our core, we're doing a plank type hold. I would like to do this on an elevated surface because people, to avoid using too much upper traps. So the position is, you can either go like this, plank position, so you see it sets a good position for your head and neck, so that you don't use too much of the muscles here at the base of the neck. You want to use abs. Or you can go like this, you go fists and step back into your plank position. Or you can use flat hands like the push-up position, so whichever you prefer. Okay, so set the arms, step the feet back. So if you have straight arms, shoulders down from the ears, press the hands into the whatever you have. I have a coffee table, chin in. Use your glutes and abs. Try not to use your quads too much. Okay, and then walk the toes forward like inchworm and rest. Then we'll do that again. Same position. If you are doing the hand push-up type position, you can bend the elbows. If you're on the fists, I wouldn't do the elbow bending, but flat hands, yes. So we're working on different variations of a push-up position. But everybody should feel their abs. If your elbows are bent, straighten them and walk the toes forward, inchworm. Perfect. Okay, so next part of the core is the shoulder external rotation. If you have a stretchy band, you can try that, but you don't need it. So I'm going to try this here on this door handle. Okay, so here's stretchy band. But like I said, you don't need to have a band. The idea is this, that your elbow's by the side and you externally rotate the shoulder. You don't move the elbow back. That's really important. Don't let the elbow move. You externally rotate, right? So it's like this, and then you rotate out. And that rotation comes from your rotator cuff your humerus, you externally rotate, and you hold. So we're starting with the left arm. So the elbow by the side. If you have a band, see there's slack. I have no tension. Now I'm going to set the arm, externally rotate, and then step back a little. And then I like to test my balance here and lift the left foot. Don't bend your wrist back. Should be a neutral wrist, elbow by the side. But not jammed into the side, so it's comfortably at your side. Okay, and now we'll switch. So right hand hold. Start with the no split slack. Set the elbow, set your arm. Keep the arm in that position as you step back a little. And then if you want to, you lift the right leg. So you're building that diagonal vector from the right hand to the left foot. Okay, and now rest. Okay. So now we're going back to the beginning. So either the bed or the ottoman or your stability ball or bird dog. Okay, so bird dog people is right arm lift. The bed, the ottoman group or ball group is torso lift. The bed group is both arms lift. Okay, rest. A bird dog left arm, other groups do the same that you just did. And then rest. Always we want to feel that we're bracing, embracing, not like tightening up. That's not a good thing, but just bracing here your abs and the lower back. And for sure, everyone should feel their glutes. So now is the leg lifting. So if you have your ottoman or the ball, you have both legs lift. Bird dog group is left leg only. And rest. Okay, and bird dog right leg, other groups both legs. Okay, and rest. Okay, and then plank position. So you can be on the elbows or fists or hands. So set the body angle. If you are on the push-up position on the hands, you can bend the elbows. And then straighten the arms and walk the toes forward and rest. So this will help you have good support for different angles through a push-up. Okay, again, same. So either elbows or fists with straight arms or push-up position. You can keep straight arms, that's fine, or you can bend the elbows a little. Straighten the arms, walk the toes forward. Okay. So now the shoulder external rotation hold. I'm starting here, left arm. Left hand has the band or not. You don't have to use a band, like I said. Okay. The elbows by the side. There's slack. Then externally rotate. So you set the arm. Hold the arm at that angle as you step back to create a little tension, not a lot. And then if you want to, your left leg up and hold. Okay, rest. And now right hand. So the arm is elbow by the side, externally rotate, you have a little tension, step back, right leg up, and rest. Okay, now we're going through that cycle one more time, and then we'll finish off with neck strengthening. Okay, so back to the Ottoman or the ball. On bird dog, people, is right arm. Bed group, chin is supported, hands at lower back, lift both arms, slide one hand over the other. Ball group or Ottoman group, torso lift. And rest. Okay, bird dog left arm. Other groups the same. Same that you just did. Everybody should feel their glutes engaged. Shoulders are down from the ears. Lower back and abs are braced but not cramping. And rest. When we do the leg lift, I like to have the feet right together. So the heels are together. Okay, legs are straight. Make sure the legs are straight. Glutes engaged. Bird dog, people, is left leg. Other group, both legs. And rest. Okay, and bird dog right leg, other group both legs. And rest. Okay, and now the push-up hold. So you can be on the elbows plank position or on the fists. Or set up push-up position, bend the elbows a bit. Okay, then straighten the arms and walk the feet forward. Okay, this is the last one. So arms are straight here, or you're in your plank position on the elbows, or elbows are straight. On fists or hands. Shoulders down from the ears, brace your abs. Okay, and walk the feet forward. Okay, and now the band. Okay, so left hand. So again, if you don't have it, you just have the arm by the side and externally rotate. Or here you have the band. Externally rotate, no tension at first. Small step back. Left leg up. Now the side ribs, see if you can engage the serratus muscle on the side ribs. This is actually the most important part here. The side ribs just below the underarm. Feel the serratus engaged. Rest. For some people that might happen naturally, most people you have to deliberately contract. So right arm, no tension, externally rotate, step back to create a little tension, right foot up, engage serratus. When you have the lower traps and the serratus engaging well, that offloads the upper trapezius in our everyday lives. The upper trapezius at the base of the neck becomes really tight and overactive from, hunching forward over computers and car steering wheels and slouching in comfy chairs. But then, that perpetuates into the system like this. So when you're doing this hold particularly, you want to feel it here, right there. That's your lower trapezius and the serratus. And when you're engaged there, that offloads, this doesn't get so tight in everyday life. So that's why we incorporate this hold in this training. I can feel that. And right here, that's like not tight at all. Okay. So lastly, we're going to work on strengthening the neck flexors. So we're going to, as many of us are here, so we want to strengthen the muscles. We've already done really the back of the neck with all the different things we've done so far. But to strengthen more the front of the neck, we're going to lie down on the floor. And some people should definitely have some kind of like a pillow or a book or something under the back of the head, because you don't want to hyperextend your neck. And in fact, we're doing an exercise to prevent hyperextension of the neck. So hyperextension means this, that the back of the neck gets too much of an arch like that. So a lot of people can't get their head to the floor, or they're kind of like that. So the back of the neck is arched too much, and many people are jammed and stuck in that position. So what we want to accomplish is we want to take that arch out. So this idea of someone's pulling you from the top of your head like that. So someone's lengthening you, and that will lengthen the spine and lengthen the neck. And you'll note that automatically angles the chin down. So that's the most important component, chin down. When we do the head lift component like this, so what happens is most people, if I just say lift your head, you'll go like that, chin goes up right away. So when we do the head lift, you must have the chin in like this. So when you lift the head, the chin is always tucked in. It shouldn't go away from the throat. And that will strengthen the muscles to prevent your head from falling forward. Okay, now the position is you have right leg bent, left leg straight. Hands can be on your stomach like this or under the lower back. So always first thing is lengthen from the top of your head, chin in toward the throat. And if you can do it, you lift the elbows like that. And if you can, you lift the head and hold. But only such that the chin is into the throat, not chin away. And down. And if it's too strenuous, keep your head on the floor all the time. Lengthening the neck, chin in, elbows lift, head lift, and hold. Always shoulders are down from the ears. Down. If it hurts your shoulder, keep your hands on your abdomen. Lengthen the neck, chin in, elbows up, head up, hold. And rest. Right leg straight, left leg bent. So we're going through 4 sets. That was set 1. Lengthen, chin in, elbows lift, head lift, hold. Keep your right leg relaxed. And rest. Lengthening, chin in, elbows up, head up, and hold. And rest. Okay, lengthen, chin position, elbows up, head up, and hold. And rest. Okay, let's switch sides. Left leg straight, right leg bent. So this time we'll incorporate diaphragmatic breathing. So first lengthening, chin down, elbows lift, head up, deep breath. Diaphragmatic breath. And relax. Reaching back from the top of the head, chin down. If you can do it, you lift the elbows. If you can do it, you lift the head, but everybody breath. And rest. Lengthening, chin, elbows, head up, and breath. And rest. Then switch. Left leg up and right leg straight. So lengthening the spine, this helps decompress the spine, chin down, elbows up, head up, and breath. And rest. Reaching top of head, chin down, elbows up, head up, breath. And rest. And last one, lengthen, chin position, elbows up, hold the chin in, head up, and breath. And rest. Okay, and now just take the arms out, whatever feels comfortable. Okay, so now my recommendation is if you have time, take a few minutes here and just lie down like this. You've just really worked lengthening the spine from the base of the skull right to your tailbone. And you've strengthened muscles all around the spinal column, the intrinsic stabilizers of the vertebrae, to help hold your spine long and strong so it doesn't collapse. So this kind of series that we've done today will help prevent degeneration of the spine and all other of these spinal issues, but also will make you muscularly strong so that you can play golf and go swimming and go for long walks, do all the wonderful activities of our lives. So if you can just relax here for a couple of minutes, this will be the best way to assimilate all the hard work you've done. And when you come to getting up, make sure you don't sit straight up, you'll just strain your neck. So when you come to standing, if you could turn over onto the side, all the way over, and then flip over to hands and knees and stand, see if you can remember that. And hope to see you next time. Thank you so much for coming and have a great day.